want to welcome you and thank you for joining this evening our informational webinar about medical aid in dying and the Delaware law authorizing this option, which will very soon be accessible to qualifying patients. My name is Heather Pope. I am the Delaware campaign manager at Compassion and Choices, which is the nation's oldest and largest nonprofit organization who is dedicated to improving care, expanding options, and empowering everyone to chart their own end-of-life journey. Before I jump into our content and start the slides this evening, I just want to go ahead and share a few housekeeping items. Before we begin, just want to share number one, if you need live captioning, if it would help you to see words on the screen along with us speaking, whether in the English language or Spanish, you can feel free to enable that option at the bottom of your screen by clicking the double C button, and then follow the prompts that'll be shown there on your screen. If you have any questions throughout the program that you'd like to ask, you can go ahead and put them in the Q&A box, which you'll see located at the bottom of your screen. So no needs to raise your hand, and at the conclusion of the program, we will take questions directly in a Q&A portion, and we will address as many questions as possible in the time that we have this evening. And lastly, want to share too that this webinar is being recorded. And regardless of if you're present watching live or watching this after the fact online, we will be recording and sharing this widely to make sure as many folks as possible get the information that we'll be sharing this evening. I am excited to be joined for a section of the program by a member of our policy team, my colleague Jaspreet Chowdhury, to share some of this content with you. And then throughout the presentation and particularly doing our Q&A program, I'll be joined by a few more of my colleagues, and I'll go ahead and introduce them when the time comes. But for now, it is my pleasure to share with everybody here an overview of medical aid in dying and some specifics to the law in Delaware. Here we go. All right, so as I mentioned, my name is Heather Pope. I'm the Delaware campaign manager, and Jaspreet will be joining me. We have both worked at Compassion and Choices for several years now on the campaign to authorize medical aid in dying legislation. Now we have the exciting job and privilege to work towards implementing that bill that has now become law, making sure that as medical aid in dying becomes an option to terminally ill Delawareans, that the law is implemented in a way that is as effective and safe and equitable as possible. So just to go over today's objectives, together we'd like to explore the full range of end-of-life options that are available to folks at the end of life in Delaware, understand the fundamentals of medical aid in dying. We'll review key provisions about Delaware's medical aid in dying law specifically, and identify some resources available for patients and healthcare providers for navigating the law in Delaware. I want to add too that this will not be the last webinar we host for the general public, as well as we have specific programming in the works, educational sessions geared directly for care providers and healthcare professionals in the state of Delaware. So be sure to stay in touch with us for information about that next informational webinar. So now that you know just a little bit more about myself and some of my colleagues here at Compassion and Choices, what makes us a credible source of information about this, and what qualifies us to be speaking about medical aid in dying in Delaware and the process of requesting. So Compassion and Choices is the nation's leading nonprofit working to improve care, expand options, and ensure that everyone can navigate their end-of-life journey in the way that they want. And for over 30 years, Compassion and Choices has led that movement to change hearts and minds and laws, really advocating for policies and practices that give people more comfort and control in their end-of-life care. And when we talk about end-of-life care, it's important to understand that people have a wide range of options. These options empower individuals to make decisions that are reflective, again, of their values, their beliefs, and their specific medical needs. Some individuals may choose to pursue every available life-sustaining treatment, while others may decide to refuse or discontinue treatments that no longer improve quality of life or align with their goals of care. And compassion and choices empowers people to consider those goals ahead of time and supports individuals with whatever choice they make for their end of life care. We'll go ahead and define some of these terms and break down what these different end of life options really are, starting here with hospice. And hospice includes an interdisciplinary team of caregivers that provide comfort and support to terminally ill people when medical treatment is no longer expected to cure a disease or prolong an individual's life. And this service, the service of hospice, most often takes place within a patient's home. At the center of hospice and two at the center of palliative care is the belief that each of us has the right to die pain-free and die really on our own terms, and that our families too will receive the necessary support to allow us to do so. When we talk about palliative care, what we're really referring to is comfort care, care that is non-curative, but manages the symptoms that an individual is experiencing. And that includes spiritual and emotional support, which is important to note. Palliative care is different from hospice because it can be done in conjunction with curative care and is not only restricted to individuals that are terminally ill. Another end of life option that is available to folks in Delaware and elsewhere is the option of voluntarily stopping eating and drinking, which is sometimes referred to in shorthand as VSED. VSED is a legal option in all 50 states and can be a conscious choice for those who wish to hasten death in a peaceful and self-directed way. Then there's the option of medical aid in dying, which we will dive a little bit deeper into in further slides. And want to take a moment to clarify too that palliative care is available to anyone who requires comfort care and symptom management, not just individuals who are at or nearing the end of life. So both hospice and palliative care are still available to people pursuing medical aid in dying, people pursuing VSED. Those options remain available. And understanding these options that are available to you and others in your state at the end of life allows Delawareans to have meaningful conversations with their loved ones and their healthcare providers and their faith leaders, should they have one, to ensure that the care that they are receiving at the end of life aligns with the needs in their body, those physical needs, and the spiritual needs. And in jurisdictions where medical aid in dying is not authorized, terminally ill people are often denied access to this option because of state boundary lines, right? And in some cases, forced to travel out of state to receive the care that they want at the end of life. So that is why we and our organization work to expand access, so that way no one has to leave home in order to die the way that they want. On your screen, you will see a map of the United States that outlines the state of aid in dying in the United States today. So medical aid in dying is currently authorized in 12 jurisdictions, giving tens of millions of people across the country access to this compassionate end-of-life option. The movement began in Oregon and has steadily grown with increasing momentum in recent years. Oregon was the first state to authorize medical aid in dying, with voters passing their law in 1998, which became effective in 1997. Oregon was the first instance of medical aid in dying being authorized in the United States. The state of Washington followed in 2008, with its law going into effect the following year in 2009, which was passed by a strong majority of voters. Next, we had Montana, who became the first state to actually authorize aid in dying through a court ruling, which took place in 2009. So there is no specific law or statute in Montana that authorizes aid in dying, But there are protections in place that protect care providers and those who are acting in full compliance to be able to safely participate in that process in Montana. That was followed by Vermont, which became the first state to pass the law through a legislative process taking place in 2013. It was followed by California in 2015, with their End of Life Options Act taking effect in the following year, which significantly expanded access to aid in dying in the US, just given the sheer population size that California has. Next, the movement moved to Colorado, which passed the law in 2016 through a ballot initiative. Washington, D.C. authorized medical aid in dying in 2017 after passing local legislation in 2016 and clearing a congressional review. Hawaii passed its law in 2018, which provided long sought access in the island state. New Jersey and Maine both passed legislation in 2019, and New Mexico passed one of the most empirical medical aid in dying laws in the country in 2021, with key improvements in access and equity being made to the law that have been based on years of experience analyzing other aid in dying laws within the United States. In Delaware, as you may have heard, medical aid in dying was signed into law on May 20th of this year by Governor Matt Meyer. We will discuss a little bit more about the history and the request process of the law in Delaware in upcoming slides. And a new and exciting development, as you may have noticed with our little stars here in the state of New York and Illinois, indicating that a governor's signature is currently pending. Within the last few months and earlier this year, bills to authorize medical aid in dying, as of this recording, are currently awaiting action from their state governors in the state of New York and the state of Illinois. So let's dive a little bit deeper now into what medical aid in dying actually is. Medical aid in dying refers to a practice in which a mentally capable, terminally ill adult may request a prescription from their healthcare provider for a medication they can choose to self-ingest to die peacefully. The multi-step request process, strict eligibility criteria, and other safeguards that are embedded in medical aid in dying laws really ensure that anyone pursuing this option is protected. As we shared, this option will soon be available in Delaware. And again, just want to clarify that those who qualify for aid in dying and seek out that option are not limited from participating in things like hospice and palliative care. It's important too to take a moment to recognize that this isn't something that happened overnight. There was years and years of efforts by so many people that really led to this bill becoming a law. So let's take just a short moment to reflect on that work and the progress that had been made and how we got here today. After nearly a decade of tireless grassroots advocacy, determined legislative leadership, and the unwavering voices of patients and their families, Delaware became the 12th U.S. jurisdiction to authorize medical aid in dying. This historic legislation was championed over multiple sessions by State Representative Paul Bombach and Senator Brian Townsend, whose efforts began in 2015. The bill was carried to final passage by Representative Eric Morrison following Representative Bombach's retirement. Over the years, our piece of legislation, the Ron Silverio Heather Block End of Life Options Act, was named in honor of passionate Delaware advocates Ron Silverio and Heather Block. It gained momentum and earned the support of key legislative leaders, medical professionals, and community allies, such as the Delaware Nurses Association, the Delaware Psychological Association, the Delaware League of Women Voters, and the Unitarian Universalists of Delaware Advocacy Network, just to name a few. From emotional testimony in committee hearings to powerful storytelling in the media, advocates built a movement rooted in compassion and persistence. Despite setbacks, including an unfortunate veto by the outgoing governor last year in 2024, us and our supporters remained resolute. The milestone of this bill becoming law reflects over 10 years of relentless organizing, strategic advocacy, and courageous public engagement, which is really a testament to what is possible when compassion meets persistence. Just in the last few weeks, we lost an incredible advocate on our team, Miss Judy Gavados, who you'll see towards the middle of your screen with the lovely black and red checkered jacket. Judy, after fighting for this legislation for many years, unfortunately died before medical aid in dying was made accessible to qualifying patients in Delaware. Her death is the most recent of a number of terminally ill advocates who died waiting for this option in Delaware. It's important to name that and honor the contributions of those who fought for access to this law but died without the option. I'd like to say their names aloud. Ron Silverio, Heather Block, Tom LaFollette, Chuck Nothey, Diane Kraus, and Judy Gavados, who are all pictured here. I want to name too that these are only the individuals that we had direct contact with and worked with in the state of Delaware who wanted this option. We know that there are others, right, who would have benefited from having access to aid in dying in Delaware and died without that option. And it is in their honor and memory that we work towards implementing this law and ultimately supporting patients through their journey in accessing should they choose and qualify. The Ron Silverio Heather Block End of Life Options Act, as we said, was signed by Governor Matt Meyer on May 20th of 2025. Qualifying patients can begin requesting this option on January 1st of 2026. That is 1 month from today. The Department of Health and Social Services in Delaware has been diligently working with an advisory group, of which Compassion and Choices is a part, working to establish the regulations which will inform how the practice of medical aid in dying is implemented in Delaware. Medical aid in dying is available to terminally ill adults who meet a very specific set of criteria. To be eligible, a person must be 18 years or older, a Delaware resident, mentally capable of making their own healthcare decisions, diagnosed with a terminal illness with a prognosis of 6 months or less, and physically able to self-ingest the medication. I'd like to name explicitly that advanced age, disability, and chronic health conditions are not qualifying factors for medical aid in dying. There are many safeguards that are baked into the law to ensure that only those getting to the end of the request process and obtaining and ingesting aid in dying medication, should they choose, are those who the law is intended to support. So those safeguards include things like an in-depth request process that ensures only qualified patients are participating, which we'll discuss more in depth in a moment. If either healthcare provider who's supporting the patient's request has concerns about that individual's mental capability or their capacity and ability to make an informed decision, they must make a referral to a mental health professional for an assessment. An aid in dying medication cannot be prescribed until the requesting individual's mental capacity is affirmed. Self-ingestion is the only method of taking aid in dying medication. I'd like to too say explicitly that taking aid in dying medication does not include any type of injection or infusion through a vein or any other excuse me while I say this word, I'm not a medical professional. parenteral, I think I said that right, route by any person. So no one is administering medication via injection or infusion, not the patient, not a healthcare provider, not a family member, and again, not the patient themselves. Aid in dying medications are prepared only by a specialty compound pharmacy because it is a high dose mixture of multiple medications. And aid in dying medication is provided to the patient in the form of a powder. When the patient is ready and decides for themselves that it is time to ingest the aid in dying medication, that powder is mixed with a very small amount of liquid, somewhere between 2 and 4 ounces of liquid, which is usually water or apple juice. And that creates a thick substance that the patient then self-ingests. Drinking or swallowing the medication is the most common form of self-administrating aid in dying medication. But for all patients, that isn't necessarily an option. And for some, it may not be their preferred route of ingesting aid in dying medication. So there are other options, whether it be through a rectal catheter or through an existing feeding tube or ostotomy bag. Those are the main, or the only rather, options of ingesting aid in dying medication. So that would either be orally through drinking and swallowing, through a feeding tube or ostotomy bag, and lastly through that rectal catheter. Conversations about the method of self-administration for the individual requesting aid in dying and how that specific person's GI system can best absorb the medication is a really important part of the conversations that an individual has with their healthcare team during the process of requesting aid in dying. And the most important thing to emphasize, regardless of the route that is chosen by the patient and their care team to ingest this medication, is that the patient themselves is self-administering the medication and remains in full control of the process. And there are steps built into the request process to ensure that the patient who is wishing to utilize aid in dying medication is pursuing the option of their own volition. These safeguards that are contained within the Delaware law are consistent with those in other authorized states and really ensure that the option of aid in dying is reserved for those who truly need it and can make an informed voluntary choice to use it. The law too contains some really important protections for those providing care and those seeking care. So I'll go ahead and name some of those now. No individual is forced to participate in the medical aid in dying law. No patient, no healthcare provider, no pharmacist, every person who's touching the process in some way can make the decision to opt out if they don't wish to participate. So no one is being forced to participate in the process, not providers or patients. Those that are acting in full compliance with the law are legally protected from civil and criminal liability or professional discipline for honoring a patient's request. There also is language that's built into the law which explicitly states the self-administration of medication to end life in a humane and dignified manner by a terminally ill adult should not impact life insurance or annuity policies. Another important item to note is that the attending provider must inform the terminally ill adult requesting medical aid in dying about all other end-of-life healthcare options. So some of these other options are the items that we discussed in one of the earlier slides, right? So that could include comfort care, hospice care, pain control, and things like palliative care as well. The providers that are authorized to participate in the aid in dying process are those who are Delaware licensed physicians or advanced practice registered nurses, which is sometimes in shorthand referred to as an APRN. A qualified patient must see two healthcare providers, an attending provider and a consulting provider. The difference between these is that an attending provider is designated by a qualified patient to have primary responsibility for their terminal illness, while the consulting provider must be qualified by specialty or experience to make a professional diagnosis and prognosis related to the patient's terminal illness. At this point, I would love to turn the presentation over to my colleague Jaspreet, who is going to walk us through how a patient in Delaware would go about requesting aid in dying. Go ahead, Jaspreet.
Thank you so much, Heather. Indeed, it is both a present and a presentation to be able to speak about Delaware's medical aid in dying law. To emphasize again, the two crucial parts of the request process are that two healthcare providers must confirm the patient's eligibility as well as verify the patient is making an informed voluntary decision to request aid in dying medication. If either healthcare provider questions the patient's ability to make an informed healthcare decision, they must refer the patient to a mental health professional, either a psychiatrist or a psychologist, to evaluate the patient. Again, medication cannot be prescribed until capacity is confirmed. Next slide, please. To get more down to the nitty-gritty, the patient must make 3 requests to their attending healthcare provider. 2 of these requests must be oral and 1 is written. An individual must make the second oral request no fewer than 15 days after making the first oral request to their attending provider. Additionally, the attending provider may not write a prescription less than 48 hours after the written request is received. A completed request for medication to end my life in a humane and dignified manner form, which I know is a mouthful, but that's the name of it, which will be found on the Delaware Department of Health and Human Services website, constitutes a written request, or a substantially similar document can be used as the written request. Again, only the patient can make these requests. They cannot be made through an advance directive or by a healthcare proxy, family member, or friend. The request must be made directly to a healthcare provider, not to office staff or through an online portal or by leaving a message. Next slide, please. Regarding obtaining a prescription, the attending healthcare provider must send the prescription directly to the compounding pharmacy. The licensed pharmacist will dispense the medication either in person or with a signature required on delivery to the qualified patient, the attending healthcare provider, or to an individual expressly designated by the qualified patient. Once the prescription is written, the patient may choose to keep it on file at the pharmacy until they decide they want to use the medication. The patient is still free to change their mind at any time and may choose not to pick up or ingest the medication. I want to emphasize that medical aid in dying is subject to all state and federal rules and regulations, including that the pharmacy will not accept a prescription for medical aid in dying medication directly from the patient. Next slide, please. So, the patient's healthcare team will provide information about how to prepare and ingest the medication. The type and dosage of aid in dying medication healthcare providers prescribe, including medications to prevent nausea and vomiting, varies with each individual. The medication cannot be injected, as Heather said earlier. The patient must be able to ingest the medication without assistance. The minimum amount of time the process can take from the initial request to receiving the written prescription is 15 days. However, for many people, it takes considerably longer. Therefore, we encourage people who are interested in using medical aid in dying as one of their end-of-life care options to start talking to their healthcare providers well in advance. Patients typically fall asleep within a few minutes of ingesting aid in dying medication, and death typically occurs around 35 minutes after ingestion. Finally, the patient may ask their provider or pharmacy about the cost of these medications. Before I turn it back over to Heather, I just want to remind folks again, I know that this is a very substantive heavy presentation, so if you have any questions, please put them in the Q&A portion. And now I'm going to turn it back over to Heather.
Sounds good. Thanks, Jaspreet. Echo Jaspreet's comment. This is a lot to take in, especially if the subject matter is new to you. So please, any questions that you have, know that you can ask them now with the Q&A feature, or contact Compassion Choices at any time. And I will use that as my segue into some of the resources that we offer, and some of our friends and colleagues that we work with who would be happy to support you through your journey, learning more about and potentially requesting this option. Death and dying and the process surrounding it is definitely a challenging topic for all of us, right? Whether you are the individual facing a terminal diagnosis, supporting a loved one through that diagnosis, a client even perhaps, or just seeking information as you begin research about your own end of life options in healthcare. Our end of life consultation service, which is a really cool service that is pretty unique to Compassion and Choices, was actually created to offer comprehensive information on end of life care and options, and serving kind of to normalize these conversations around death and dying so they aren't so taboo and foreign, right? So anybody who's seeking more information about aid in dying, about any end of life care option, resources related to end of life care, or if you may be experiencing an issue related to end of life care and need support, you can contact our end of life care consultation service through email or through phone. You can see the email address there on the screen and the phone number as well. EOLC@compassionandchoices.org. And the phone number to reach them is 800-247-7421. So once you reach out, it'll be most helpful to give your name, the state that you are reaching out from, or the state where the individual lives that you're calling in reference to, what specific question or circumstance they might be facing that you're looking for support with. And you can expect to be actually contacted by a trained social worker, who in 1 to 2 business days will have done research about the specific circumstance that you're reaching out in reference to, and what resources might exist to support you in that circumstance. So this service is completely free and run by trained professionals, completely confidential as well. This is something that I personally have not seen offered by any other organization, and really encourage you to take advantage of our EOLC service if you find yourself in a circumstance where it could be helpful. Our legal department as well, Compassion Legal, can help you or a loved one should you find yourself struggling to get the care that you want and deserve at the end of life. Those who may be experiencing an urgent matter can call our legal line directly. To reach there is 503-943-6513. And for instances that maybe not be urgent, but still a priority that you'd like support and feedback on, we do have an intake form, which you can reach on our website, compassionandchoices.org/legal-advocacy. We also have some great resources about Delaware's new law, with the intention to support patients and medical professionals. Those can be found at our website. You can type candc.org/Delaware. And as official regulations and the request to end my life in a humane and dignified manner form is made public by the Department of Health and Social Services, which we are expecting on January 1st. That will be available as well on our website, candc.org/Delaware. Lastly, I'd like to plug too that if you're interested, feel free to keep up with us on Facebook. That's where we post fun and exciting things like the events that we're headed to, the farmers market that we're tabling out, and more presentations and educational opportunities like this for you, your loved ones, your friends and neighbors to learn more about what end of life options exist in your state. I want to explicitly name too, right, that all of the resources that we just discussed only exist because of our lovely and wonderful donors. And Compassion and Choices almost exclusively is funded by individual donors who really make it possible for us to do our work and provide resources that are accessible to everyone, and being able to, for free, give out informational booklets and support people through our EOLC consultation service. So these resources deserve to be free and they deserve to exist. And that can only happen with the support of our donors. So just want to take a moment to thank those who, whether with their financial resources or their time, have supported Compassion and Choices, and encourage anyone who may be interested in taking that leap to join us at our website, compassionandchoices.org/donate is where you'd make a financial contribution. And on our website, you'll see a really clear, I'm sure it's blue, volunteer button that you can click to sign up as a volunteer as well. All right, that is the conclusion of our formal programming.